I want everyone to know that, there is a crisis within women's health. And I think that we need to have the conversation. We need to add more dollars into women's health. We need to add more dollars into, especially maternal morbidity and how it affects Black women, where Black women are 3 times more likely to die from pregnancy complications. And it's 8 times more likely here in New York City. Hence, that's why I open Trust Women's Healthcare. I think that that's one. I think that we need to, as a community, as a society, to really start to find the solutions to this problem.
Welcome to Business Ninjas, brought to you by WriteForMe, where you'll hear from business leaders who are out there growing their business and slaying it every day. Learn from the masters. Let's get started.
Hey, everybody, welcome back for another episode of Business Ninjas. I'm here today with Dr. Peggy. She's the founder and CEO of Trust Women's Healthcare. Dr. Roberts, welcome to the show.
Hi, thank you so much, Kelsey, for having me.
Yeah, excited
Happy
to
New
be
Year. Yes,
here.
absolutely.
Can't believe it, 2024. Well, thank you for joining
2024.
us on the first episode of the new year. Before we dive in, why don't you start and tell me a little bit about yourself?
Perfect. So I am Dr. Peggy. I am a women's health nurse practitioner. I own and operate Trust Women's Healthcare in Brooklyn, New York, where we provide comprehensive overall health and wellness for women. Trust Women's Healthcare was founded to combat the maternal health crisis in this country and representation within women's health. So we do everything from gynecological services to prenatal care, ultrasound, including medical weight loss and IV hydration therapy.
Wow, that, obviously an important, mission to have, specifically in Brooklyn and across the United States. So tell me a little bit more about, your passion and your drive for starting Trust Women's Healthcare.
Perfect. So let me start by saying I love, love, love women's health. I think women are the center of the families. We often neglect ourselves, and there's not a lot of research out there regarding women's health, especially within the BIPOC community. Women's symptoms are often dismissed or ignored. There's lack of representation as being a Black woman. So I thought it was prudent upon me to establish a healthcare practice where I can be part of the solution. So in doing that, I founded Trust Women's Healthcare in June of 2021 in the middle of the pandemic. And it's been an amazing, amazing ride. We have seen over 2,500 women. Just I'm the sole provider there myself. So, there definitely been some wins, there definitely been some challenges, but overall, the community has embraced us, and we are sticking to our mission and our vision and providing overall health and wellness for women. Women should know their numbers. They should know in terms of what their health is like. And we pride ourselves in ensuring that we stick to that.
And you mentioned talking about Trust Women's Healthcare, about some of the services that you offer. Talk to me a little bit more, about those services.
Sure. So, women do not like going to get their gynecological exam. That's just something we dread every single year. So I wanted to create an experience. So when women walk into my facility, we have lavender walls. It smells like lavender. We have a chandelier in the office. So it sets the tone even before they are seen. So it gives them that relaxation that they're needed. Because again, sometimes this is their first gynecological exam. They have an issue going on. And most often, I'm finding that women have had ongoing conditions that they've been to multiple providers. So this is just another provider they're coming to. So they're already anxious about it. So right when you walk into the door, I want to create that relaxation experience. We have appointments available. We pride ourselves on our wait times being really non-existent. Patients are in and out within an hour with the allotted time. I don't want you to think that we're rushing through everything, but we are giving our client the time that they need and deserve so that the schedule is accommodating that way. And it's really, I wouldn't say it's a one-stop shop, but we're able to address their needs all in one visit. Even though they're coming in for an annual exam or a problem visit, we discuss things from their medical history, their family history. We discuss pre-pregnancy counseling, whether they're thinking of pregnancy or not, just making sure that they're up to date on all preventative screenings. And then
Mhm.
we also offer the medical weight loss because that hones in, and obesity is such a challenge in this country that we want to be able to add those services. And being obese can trickle down and leading to a lot of gynecological conditions such as PCOS, abnormal periods. So we really incorporate that as well.
Mhm. And it sounds like, you started off kind of with just, if correct me if I'm hearing this right, just starting off with those OBGYN services, and you've been really able to grow the practice into so many different areas. Like you said, you know, being able to pull in and provide an all-encompassing, women's healthcare service for your patients.
Absolutely. And this didn't just start from the beginning. This was really, it was born from women telling me what they need and where, and they can't find it. So in that, listening to my clients and listening to what the needs are, that's how I was able to expand to these services and really really provide that overall health and wellness.
Mhm, mhm. And that brings me to one of my questions, talking about, what makes Trust Women's Healthcare really stand out from from other practices in Brooklyn and, in New York. So talking about, like you said, providing that representation, to that population, and being able to emphasize that whole person, that whole women, practice. Am I hearing that right?
Absolutely. And then also we have our hours. We're able to accommodate that everyday person that is working, that can't take off to get their preventative health screening. So we take our last appointment at 7:40 p.m. During the week. We do have a Saturday hours as well. We open as early as 10. So we provide access. I think access is very important. And also we accommodate same day appointments. Also, when women reach out to the office, we're able to get back to them in a timely fashion, given provided what's going on for that week. But we really strive in doing that. And then also the wait times. I think that that's really important. Respecting people's time. I think it's very important because then that will allow them to come back and really feel that they want to get their health in order. Don't want to create another barrier that has been within the healthcare system. So having the ability to receive access and be able to schedule appointments same week, be able to be seen, be in the room within, 15, 20 minutes. I think that that speaks volumes. And also, I have my staff knows that one of my pet peeves is clients waiting. Don't like clients waiting. And they know that if they're waiting, there's something going on. So I make sure that the schedule accommodates that as well.
It sounds like, there's one theme that I'm kind of hearing throughout this process of our conversation, and that's really that the relationships are the center of your practice, and that making sure that there's, that intimate relationship, women trusting you with some of, the most gentle and, concerning aspects of their life. Am I hearing that right?
Absolutely. And you kind of hit the hammer on the nail, putting the trust back in women's health. Like I said, women's health has been neglected for far too long, especially among, like I said, women of color. So we wanted to, that's where the name came from, to put the trust back in women's health. And it is a relationship. I'm meeting with these women in the most intimate settings, the most intimate issues that they're having. So there has to be that relationship. When I go into a patient's room, and I treat everyone the same. I do the same things for everyone. I come in, I introduce myself if it's a new client, and I sit down and really have a conversation.
Mhm.
And eye contact, a lot of times you hear that you go to providers' offices and they're standing up the whole time. They're not hearing you. They're in and out within 5 minutes. So I wanted to kind of shift the narrative with my practice and being able to have women feel very comfortable in coming and want to come. And like I said, not really creating that barrier.
Mhm. I'm curious to hear from your perspective, because not only are you practicing, but you're also founder, CEO. Talk to me about that journey for you as an entrepreneur, because I imagine they probably don't teach you that in med school.
So yeah, so in graduate school, I definitely did not learn the business side of healthcare, and I want to be correct. Healthcare is a business. In order for us to do what we do, we have to be able to care for clients in a profitable way. That's how we're able to sustain. So, learning this really starts from the infancy stages and doing the due diligence and meeting with and hiring the right team, the consultants, the attorneys, the accountants. It all started stemming from that. I know the clinical side, don't know the business side. And that was important for me to really try to get a team together for us to do this the right way.
Mhm,
And also, there were things that I just didn't know, in my training, working for a large health system, there are things that we don't know behind the scenes. And it's really, really siloed in that way. So being an entrepreneur, especially within the healthcare space and dealing with insurance payers, which we do hybrid services as well, but mostly we take insurance. It's really a language and a system within its own. So for anyone out there, it's really to create and to get that team because you cannot do it yourself. It doesn't matter. There's no program out there that will prepare you to be an entrepreneur in healthcare.
mhm.
There are experts that you have to lean on and to get the right team and to also lean on your colleagues because you'll be surprised everyone is doing. There are a lot of people that are doing this and we're all in the same boat. So learning to be an entrepreneur in this healthcare space in the private practice definitely was challenging. And me and my significant other who does a non-medical services and our chief financial officer, we really work well together in terms of ensuring that there's a balance, that I'm able to provide the best care in the most profitable way.
That's, I appreciate you sharing that. And, certainly important, obviously, for running a business and talking about being able to continue to grow the practice. So, is there anything that's, on the horizon or where you're looking to continue to grow trust?
Absolutely. So, as I mentioned, I am the only provider there. So I am definitely looking to add more providers and more services. And my goal is to have a women's health center where women can get the primary care services, the gynecological care, and the psych services, because those are the three needs that women are looking for. So definitely looking to add more providers to our location and then to see where it grows from there. I think what I want to always have is to stay true to the mission and the vision. And I don't want to lose that because I think that that's what makes us special. I think that we're able to communicate and to connect with our clients. I think that customer service is also important. And I don't take that for granted at all, even though I'm providing a service that it's needed. I don't make light of the customer experience, the patient experience. I think that that's very, very important as well. And also, like I said, all patients are, they speak to someone regarding their results. I think that that's important. So staying true to the foundation of the practice is very, very important. But then we also want to scale and grow and to be able to service as many women as we can across the tri-state area.
I love that. I love that. Well, Dr. Peggy, as we start to wrap up this conversation, is there anything that you could provide some insight on, both on kind of the business ownership side and also, the healthcare side about how maybe people can advocate or support, the mission of trust or support, having representation of people of color in healthcare? Anything that people can do to support that?
So first, I want to start with the client and patients. I think it's important that you have to get your health in order. I think that there has, yes, been a lack of there's been a lack of trust within the healthcare system, but there are providers out there that want you to come in, that want you to get the care. Also, if you feel that you're not getting the care that you deserve, start looking around, start, trying to find, listen to, ask girlfriends, ask colleagues, because there is someone who is very um happy with their provider. And maybe that, you can find that as well. So if you're not getting the answer, don't just leave it there. Try to get a second opinion, try to ask around. I think that that's very, very important. Also, in terms of the business side, I think that one thing that I've learned in this journey is time. Time will tell a lot of things. And the journey of entrepreneurship cannot be fast-tracked. It cannot, there's no shortcuts. You just have to allow time. And I think we've been seeing steady growth and we have scaled so dramatically. But I think that we scaled in a way that allowed me to fix the kinks and to fix the errors within the system. Growing too fast, sometimes you're not going to be able to correct the wrongs within your business. So I think that if anything is time, give time for things to happen, and it will happen. It absolutely will happen. And also lean on colleagues, find support, podcasts like yourselves. I think that education, you have to educate yourselves. And then lastly, to know the finances of your business. I think that that's very important. Even though we are providers, we are entrepreneurs as well, and we need to act accordingly. And I know that trying to really learn the finances of the business will also help you provide more efficient care to your patients as well.
I think that's fantastic. Well, Dr. Peggy, like I said, as we start to wrap up this conversation, one, I love the mission of Trust Women's Healthcare, the work that you're doing. I think it's impactful and it's powerful. And I really like the emphasis that you've placed specifically on this episode of taking healthcare and taking, your needs into your own hands. And, I think what better way to start out, the 2024 Business Ninjas podcast with, the importance of women's healthcare and, taking ownership of that. So, is there anything that you want to leave our listeners with as we start to wrap up, talking about the importance of taking that healthcare into your own hands or the business? Anything you want to leave our listeners with?
And I want everyone to know that, there is a crisis within women's health. And I think that we need to have the conversation. We need to add more dollars into women's health. We need to add more dollars into especially maternal morbidity and how it affects Black women, where Black women are 3 times more likely to die from pregnancy complications. And it's 8 times more likely here in New York City. Hence, that's why I opened Trust Women's Healthcare. I think that that's one. I think that we need to, as a community, as a society, to really start to find the solutions to this problem. And then, then again, I also want to leave your listeners with, we are out here. We are just trying to provide the best care that we can, and if there is an issue, a concern, please, please, please reach out. You could reach out to me if you're in the New York City area. And I think that we need to really address this healthcare issue. And healthcare is something that needs to be a priority for everyone.
Yeah, I completely agree. Well, Dr. Peggy, thank you again so much. I think this was a fantastic conversation. I appreciate all of your insights, your guidance, and I really appreciate you being on Business Ninjas today.
Well, thank you so much for having me. I definitely appreciate it.
Yeah, great to have you.